Assalamu alaikum everyone. I hope everyone is doing well. Today we are going to discuss inflammation, that is what we define is response of a tissue to injury. Well, the word itself may not sound that pleasant. However, it is routine for us to sustain injuries every moment. Okay, for example, I may be appearing apparently well enough at this moment, but my skin may be under constant microbial invasion. Okay, similarly, the sheer stress of blood flowing in my capillaries may be causing constant injury to the blood vessels. Okay, so even though it is not something good, it is something of a routine to have injuries, and whenever we have injuries, the human body tends to respond to it. Okay, and that response is what we call inflammation. Okay, you may go it that way, or if you feel like there is constant space for improvement, we may go on to add a few more words to make it even more crisp. Okay, you see, this is not just a single event, rather multiple processes are occurring at the same time soon after injury. So we may go on to add the word collective, so that is a collective response of a tissue. And still later, a dead tissue will not mount such a response. This is just the ability or characteristic of a living tissue to respond to injury. So we may go on to add the word living here, so that it is now the collective response of a living tissue to injury. Okay, and this is characterized by multiple events. For example, there is vasodilation first, so as to increase the blood flow in the injured tissue, and there is increased vascular permeability, so that the elements contained within the capillaries, within the blood vessels, like the inflammatory cells and the clotting factors in the plasma, can leak out of the vessel into the site of injury. Okay, and then still later, there is clotting in the interstitial spaces around the injured site, and there is migration of more and more inflammatory cells, particularly neutrophils and macrophages, into the site of injury. And still later, it takes some time to develop those signs of inflammation. Even though we will discuss each one of them in bit greater detail, but at this moment, what I want you to understand, vasodilation and increased vascular permeability are vascular changes. Those are changes in circulation, okay? And they are just meant to allow the passage of more and more inflammatory cells and clotting factors into the site of injury. Okay, so that the primary event, the desirable event is here is clotting in the interstitial spaces and migration of inflammatory cells. Okay, so here we have, if you go for the breakdown, we have two types of events. We have vascular changes to allow the passage of inflammatory cells and clotting factors into the injured site. Okay, so to begin with, for example, if this is the site of injury on the skin, we happen to sustain a needle prick injury, and suppose that needle is contaminated with microbes. Okay, so the first thing that will follow will be vasodilation in the surrounding blood vessels, the capillaries in the surrounding subcutaneous tissue. Okay, and to begin with, it is quite logical to ask, what after all causes so many events? What drives so many responses? And the answer is the injured tissue itself. The injured tissue, owing to tissue damage, releases certain chemical mediators of inflammation. For example, in this case, there is a release of histamine, bradykinin, and serotonin. Those cause vasodilation, that is, an increase in the diameter of the blood vessels in the surrounding tissues. Okay, similarly, as we know, the capillaries are lined by a thin layer of endothelial cells. okay, and they are bit opposed to each other. There are junctions between them. So whenever there is vasodilatation, the spaces between adjacent endothelial cells, you see here, widen up, so that there is now more and more space between adjacent endothelial cells and the contents of the vessel. In this case, capillary can leave the capillary into the injured site. Okay. Still later, this is all about vasodilatation and increase vascular permeability, how it allows the passage of inflammatory cells, particularly neutrophils and macrophages, into the site of injury. Okay. While all these processes occur at the same time and parallel to each other, but if there is no sequence or no order of such events, but if we have to define a certain sequence or order just for the sake of narration, so there is clotting in the interstitial spaces surrounding the site of injury. Okay. Whenever there is vasodilatation and increased vascular permeability, the plasma here contained within the capillaries, it contains clotting factors. Those clotting factors, particularly fibrinogen, will exit the vessel and they will clot the tissue spaces in the subcutaneous tissue around the site of injury. Okay, and the motive is to contain that particular threat. It may be a microbe, it may be some other damaging influence, but the fibrinogen leaks out of the capillaries and seals the tissue spaces around the site of injury, so that damaging influence or microbe is contained within a certain area and its spread is discouraged. Okay, still later, now it's the time for neutrophils and macrophages to leave the vascular lumen, the capillary, and enter the damaged tissue. Okay, so the damaged tissue, the injured one, in addition to histamine, bradykinin, and serotonin, also releases certain chemotactic factors. Okay, so that neutrophils and macrophages or other inflammatory cells are directed towards the site of injury. Okay, but this process too has got certain phenomena that needs discussion. For example, under normal conditions, the elements of the blood, the cellular elements, the cells, the red blood cells, the white blood cells, they tend to flow within the center of the vessel. Okay, and they are separated from the vascular wall by a thin layer of plasma. Okay, so that those cellular elements don't interact directly with the endothelium. In this case, whenever there is tissue injury and release of chemotactic factors, the neutrophils and macrophages, okay, they are directed towards the site of injury through chemotaxis. Okay, and this process itself needs the expression of certain adhesion molecules. Okay, the endothelium under normal conditions will not allow the neutrophils, the red blood cells, or any other cell to come closer to the vascular wall. It discourages interaction between the cells and the endothelium. But in such a case, the vascular endothelium, the endothelial cells express certain adhesion molecules, okay, and the cells themselves express certain receptors like integrins, so that they can now move closer to the endothelium. And once they get closer, as we already discussed, we have enough spaces between adjacent endothelial cells that they can escape the vessel and cause a buildup of those cells here in the injured tissue. Now, when they are here, they are supposed to protect the tissue against invading microbes or any damaging influence. Okay? They're supposed to protect the tissue. They're supposed to eliminate the damaging influence or microbe, so that tissue repair and healing can follow. Okay, but during this process, what they do, they don't work like us. Okay, those inflammatory cells release mediators of their own. Okay, they release, for example, they release cytokines, they release lymphokines, okay, they release interleukins, they release tumor necrosis factor and so many other chemical mediators, so as to potentiate this whole process. As they release more and more chemical mediators we just mentioned, there is more and more vasodilation, a sustained increased vascular permeability, and migration of more and more inflammatory cells into the site of injury. Okay, and during this process you need to remember one thing. Okay, they are supposed to protect against the damaging influences, whatever it is. In this case, for example, if it is a microbial invasion. But during this process of protection, there are no limits. They release those chemical mediators which may cause even more tissue injury than the invading microbe alone can do. Okay? So the outcome, we hope for the best. We hope for resolution of that whole event, but the outcome is not predictable exactly. Okay, things may get worse during this process, and that is the logic we use anti-inflammatory drugs, okay, therapeutically in those with injuries. Okay, and during this process, after some time, when there has been enough leakage of clotting factors into the injured site, there has been enough migration of inflammatory cells into the injured site, they release more and more chemical mediators, the affected area begins to show certain signs of inflammation. For example, it will get swollen over time. It may appear red in those with fair complexion. Okay, it becomes edematous. At the same time, it becomes painful. Okay, and if you wish to make things complicated, they have that tendency or temptation to use difficult words like calor and rubor and dollar and those things. But if you want a simple way, so those signs of inflammation include swelling, redness, pain, okay, and partial or complete loss of function. Okay, that should suffice for the time being. Now, well, before we proceed, there is one more thing. This process is not chaotic. This is not like the neutrophils, macrophages, and other inflammatory cells just rush to the site of injury blindly without any order. Okay, order is life. Loss of order equates to death. Okay, so that migration of neutrophils and macrophages and other inflammatory cells it displays or exhibits a certain order. There is a certain sequence. Okay, and we are moving to a next diagram so that we could discuss that order, how things occur in layers. There is a concept of layer defenses. Okay, the neutrophils and macrophages have their own sequence while moving on to the injured tissue. Let's see.